Hey everyone, what's up? This is Dr. Charlie Johnson, physical therapist, and in this video, I'm going to share with you a story and sort of actual interaction I had with a woman named Ginger inside my Glute Relief Accelerator program, who had tried basically everything before connecting with us. She had tried PT, chiropractic, all kinds of meds, and actually was set up for a surgical consult to resolve her back, butt, and sciatica problem, and essentially nothing was working. That is until we crossed paths. Now, one of her biggest barriers was that every motion was yucky. So if you're watching this, you have some type of back, butt, or sciatica problem. Are you going to PT? Are you going to chiropractic? Are you going to massage? Are you getting shots? But everything seems to flare things up or nothing's working. If so, this video will give you sort of a window into an outside the box way of thinking of things, because almost everybody in pain wants to treat the area in pain, which, if that's the place where the fire is burning and that's the most sensitive area of the body, gives you the highest risk of aggravating your problem and not getting the relief that you need. And so we had to take a different approach with Ginger, because we found that all the usual ways, right, of treating the problem wasn't going to work for her. So where there's a will, there is a way. Ginger has it, and we helped her discover it. So check out this video and check how we helped her relieve some of her back, butt, or sciatica pain using a completely different and totally outside the box approach.
Well, right now I'm hurting. I'm about a 5 level at least pain, and if I move much, it's worse. No movement's happy for me. From what I'm understanding here, we don't really want me poking the bear, and that's what this motion, all these motions do, is they poke that bear. So
give me like an idea of like the number that you experience when you get to a certain point, like how far you can go and how yucky is it?
Well, I just turned like this far, it's not very far as I'm sitting on a soft couch. Maybe I should sit on a chair, but it escalated about a couple notches. So I'm about a 7. I do that. It hurts. And it's mad now. So it just like stays there. Once I make it mad, it stays pretty mad.
I hear you. Okay. And if you, so now if you twist to the left, stop before you get symptoms that increase above the madness. Just, they can be just baseline. You okay with that?
Yeah.
Okay. Let it off.
Yeah, it's about a 5 still. I mean, it went down about 5. It felt good going that way, sort of, but it still hurts.
Okay, I get it. Can you do this? Now choose. Would it feel more or less threatening to do reps or holds? What do you think? Like if I was to ask you, hey, do a bunch of these reps, or just get there and kind of just relax your arms and just kind of hold it there, which do you think would feel most comfy and most safe?
Staying there.
Okay, can you stay there for like 10, 15 seconds? And you're just going to try to relax, do whatever feels most comfy. Can you do it? Let me know if symptoms jack up, though, okay?
Okay. They're not.
It's okay. Stay there.
Okay, it's starting to hurt more, so I'm going to come back.
That's okay. So the longer you held it there, it started to get yucky?
Yeah, it's pinching pretty bad right now.
If you raise your right arm above your head like this, straight ahead, not like up, just like this, like straight out in front of you and up.
In front?
Yep, sorry, in front. Yeah, like this. You okay with it?
Not a problem, yeah.
Okay, how about your other arm?
No problem.
Which arm feels best? Easiest. They're both pretty good. Okay, can you do a bunch on the left? Just give me like 15 or 20. I know it seems weird, but let me just see some here.
Oh, it is really weird.
Okay, now what I want you to do is very slowly, okay, rotate to the right and stop when you need to, okay?
Well, I just turned like this far, it's not very far as I'm sitting on a soft couch. Maybe I should sit on a chair.
Twist your trunk to the right.
Okay.
Okay, let it off. Good. Okay, give me 15 more arm raises on the left. All right, give me like 2 more. 1 more. Come on. Good. Okay, break. All right. Now, twist 1 time to the right for me. Stop whenever you need to. Again, you don't have to make it pinch worse. You just stop when you need to.
Okay.
Okay, let it off. Okay, twist 1 time to the left for me. Okay, let it off.
Okay.
Okay. All right, give me a baseline. Any number's fine. Just where are you at 0 to 100 right now in the butt? 70, 50, 40, 80, where are you at?
I'm still going to tell you 50 because I'm still hurting.
All right, so here's what I'm going to have you do. We got to start somewhere with motion, but it's got to be really safe. It's okay if it doesn't reduce it in the moment. Let's get the ball rolling with something. So I'd say, hey, could you do like 3 sets of maybe like 15 arm raises on the left side,
Okay.
2, 3 times a day, so long as your shoulder doesn't get too tired. I
Okay.
only want you to do that for the next 4 days. Let's just say until Monday.
Okay.
And then
Yeah.
shoot me a message. Good morning, Dr. Charlie. Ginger here. I hope your weekend went well with your family. I'm reporting in from our call last Thursday and can tell you that I'm feeling overall better after implementing the arm raises as medicine. To be honest, I thought it was crazy, but definitely trust the process, knowing that you've got the experience and knowledge that I do not have. Thank you for that. I've also not had an Excedrin since Saturday morning, which is a real success for me. Thought you'd like to know. I'm here to verify that if you trust the process, regardless of how crazy it seems, you will see some results. I've been dealing with severe sciatica for over 9 months and have gone through just about every treatment they can offer: chiro, PT, pills, shots, etc., and was on my way through neurosurgeons when I found Dr. Charlie on YouTube. I joined this program last November, and when I neared the end of phase 3, searching for movements, every movement for me was still yucky. During my accelerator call with Dr. Charlie, he tested a few movements with me and finally suggested that I move my left arm up and down. I was willing to go through the previous treatments, so as crazy as it sounded moving my arm when the problem was in my right butt and leg, I complied because I knew Charlie has the knowledge and experience that I don't. So despite me feeling a bit foolish, I'm literally shocked that it actually helped. All right, so how cool was that? Is it possible that you could use your arms, if you're watching this, to resolve your butt, back, and/or sciatica issue? And the answer is yes, it's possible. But the only way to tell, as you saw in this video, is to follow a very scientific process to determine immediately in the moment if something is valuable, a waste of time, or making you worse. And so if you're trying a sheet of exercises, trying lots of different things, the chance of you finding what's going to work is not good. And the chance of you just randomly trying one thing and seeing what happens, right, for weeks on end, well, that's just a waste of time. All right. So if you're looking for the most efficient way to resolve the problem, like Ginger was, right, you're tired of trying lots of random different inputs, random in, random out, random inputs or exercise equal random results. And instead, you want a very scientific, methodical process to go about resolving your pain, one that works and has worked for lots of different people because this is what we specialize in. And you want to learn how to do it yourself, most importantly, versus having to rely on other people. Then go ahead, click the link somewhere in the comments and or in the description. I would love nothing more than to review your case personally to see if/how we can help. Basically, click the link, set up a time to chat with us, and follow instructions to submit a formal case review. I, Dr. Charlie, PT, orthopedic specialist, someone who only treats these back butt or sciatic issues, a specialist in the area, will review your case personally. If I don't feel we can help, I'll just let you know. There is no cost to the call and or case review. Why do we do that? Because I don't feel right about charging people before I feel fully confident that we can help you out. All right. So hopefully that sounds fair. If you're interested in working with us like Ginger did, we work with people all around the world, and you want to learn how to use your mind and movement as medicine in a very systematic, scientific, process-oriented fashion, so you actually know what's working versus what's not, then go ahead, click the link below to apply to work with us. Thanks so much. Chat soon.